type is not affected by HIV. Your blood type has no significant effect on whether you will contract HIV. The idea that being type O offers protection is a myth. Scientists think that some people may be genetically more resistant to the virus, but this is not related to ABO blood types. Can blood type O be infected with HIV? However, the highest prevalence of hepatitis B and HIV infection was found in Group O blood donors, as confirmed by the work of Emeribe and Ejezie, 10, who reported a higher prevalence of HB's antigen in donors of Group O, 4.3%, against the 0% frequency for Group Hab donors. Which blood group is most resistant to diseases? Carriers of blood group 0, I, are generally more resistant to diseases, with the exception of H. pylori-associated gastrointestinal diseases. Carriers of antigenic blood groups A, 2, B, 3, AB, 4, are more susceptible to development of infectious, cardiovascular and cancer diseases. Are certain blood types immune to HIV? They found that the cells of people who express high levels of PARC, a rare group representing about 1 in a million people, were resistant to HIV infection. Conversely, the cells of those who express no PARC at all, representing about 5 in a million people, were particularly susceptible to HIV infection. What's the healthiest blood type? Of the 8 main blood types, people with type O have the lowest risk for heart disease. People with types AB and B are at the greatest risk, which could be a result of higher rates of inflammation for these blood types. A heart-healthy lifestyle is particularly important for people with types AB and B blood. What is the most powerful blood type? Type O negative red blood cells are considered the safest to give to anyone in a life-threatening emergency or when there's a limited supply of the exact matching blood type. That's because type O negative blood cells don't have antibodies to A, B or Rh antigens. What diseases are blood type O prone to? The researchers found that some conditions were more common in people with certain blood types. Diseases more common in people with type O were familial Mediterranean fever. Systemic lupus erythematosus. Systemic sclerosis. Sjogren's syndrome. What are the disadvantages of O-positive blood group? Evidence shows that type O individuals may be more likely to develop peptic ulcers caused by Helicobacter pylori bacterium than other blood types, and that type O women may have more risk of fertility problems, with greater risk of having lower egg count and poorer egg quality than women who are type A, B or AB. Why is O blood so important? Type O positive blood is critical in trauma care. Those with O positive blood can only receive transfusions from O positive or O negative blood types. Type O positive blood is one of the first to run out during a shortage due to its high demand. Which blood type lives the longest? Chances are higher you'll live longer if you have type O blood. Experts think your lowered risk of disease in your heart and blood vessels, cardiovascular disease, may be one reason for this. What blood type should not have babies? Usually, we don't have to worry about blood type when deciding to have a child. However, there are some exceptions. In particular, an Rh-negative mother can sometimes have pregnancy complications, though doctors have an easy way to fix this issue. What blood type lives the shortest? Having an O blood group is associated with an increased risk of death, particularly from cardiovascular disease, such as ischemic heart disease and stroke, according to research published in open access journal BMC Medicine. What is special about B+ blood type? B positive is an important blood type for treating people with sickle cell disease and thalassemia who need regular transfusions. These conditions affect South Asian and Black communities where B positive blood is more common. There is currently a very high demand for B positive donations with the subtype O. What blood type has the most heart attacks? Researchers found that compared to people with type O blood, those with types A or B had a combined 8% higher risk of heart attack and 10% increased risk of heart failure. But the biggest difference had to do with blood clots in the veins. What are the three rarest blood types? The rarest blood types are B-negative BV, which is found in 1.5% of the total population; AB-negative ABV, which is found in 0.6% of the total population; AB-positive AB plus V, which is found in 3.4% of the total population. What blood type is less prone to COVID-19? 5. Found a higher risk of COVID-19 among A and a lower risk among O blood types. Is O positive blood type good? Over 80% of the population has a positive blood type and can receive O positive blood. That's another reason it's in such high demand. O positive donors who are CMV negative are known as heroes for babies at the Red Cross because it is the safest blood for transfusions for immune deficient newborns. What are the disadvantages of O positive blood group? Evidence shows that type O individuals may be more likely to develop peptic ulcers caused by Helicobacter pylori bacterium than other blood types, and that type O women may have more risk of fertility problems, with greater risk of having lower egg count and poorer egg quality than women who are type A, B or AB. What kind of blood is Rh negative? The red cells in your blood can be A, B, AB, or O. The red blood cells also have a protein that is called Rh on the surface of the cell. Your blood can be Rh positive, which means that you have the Rh protein, or Rh negative, which means that you do not have the Rh protein. What are the advantages of blood group A+? A+ blood contains both A and Rh antigens. A+ red blood cells can be given to both A+ and AB+ patients. A+ plasma and platelet donations are important blood products that can be used for many patients needing these types of transfusions. Therefore, A+ donors are encouraged to donate platelets, plasma or whole blood.